Collaboration with ILSI North America, our research team has recently completed an exciting project resulting in the creation of a publicly accessible database to house published literature on fiber intervention studies. This presentation, Accessing the Diet-Related Fibers in Human Health Outcomes Database in SRDR, aims to provide a bit more information about using and accessing this database. Please note that we've created a detailed user manual, which is available for public download along with the database, and I'll refer to that throughout this presentation. Before we get started, I wanted to note that the database is available for download in two places. The first is on ILSI's website, and the second is on the SRDR website. I'll spend some time during this presentation talking about SRDR, its use as a data repository, and how you can access and download the fiber database from that site. Of course, if you've downloaded the database directly from ILSI's site, some of this information will not apply to you, but regardless of where you downloaded it from, you'll get the same version of the database in Excel, and so all the information that I'll describe about the actual Excel database will apply. First, I'd like to give you a quick overview of what the fiber database is and also what it is not. Broadly speaking, it's a searchable database of systematically compiled human intervention studies evaluating dietary fiber and one or more of 9 physiological health outcomes, and these health outcomes are thought to be 9 potential health benefits. You might be wondering why 9, and that's because they were the 9 health outcomes identified at the 9th Vahuni Fiber Symposium by ILSI in 2010. They include the following: total and LDL cholesterol, postprandial glucose and insulin, blood pressure, fecal bulk and laxation, transit time, colonic fermentation and short-chain fatty acid production, modulation of colonic microflora, weight and adiposity, and satiety. Getting back to the database, users can search it to identify studies of interest according to their own fiber types and/or outcomes of interest. In other words, while the database itself houses a huge number of studies, it's currently at 919 entries, users can apply their own inclusion or exclusion criteria to further narrow down those studies to a list that's relevant to their own project or interest. Of course, users should always be familiar with the inclusion and exclusion criteria applied to the overall database, and these criteria are detailed in the user manual. The database is available for free download on the Department of Health and Human Services Agency for Healthcare Research and Quality's Systematic Review Data Repository website, and that's what we'll go forward calling SRDR for short. The user manual is also available for download there, and I'll go into more specifics later on how exactly to access those two documents. The database captures PICO or PICO information, which stands for Population, Intervention, Comparator, and Outcome. It's important to note that the database does not capture results or assess study quality. In other words, you could use the database to identify a paper that examines, like for example, psyllium fiber and blood pressure, but you would need to actually go back and access and read that paper yourself to determine the direction of the effect, and also if you wanted to determine whether you felt that paper was methodologically sound. The fiber database can be used as a starting point to conduct a systematic review on fiber and one or more of the 9 health outcomes of interest, saving substantial resources like money and time on that initial phase of the literature search, and also on the phase of screening and extracting PICO information. It can also be used as a preliminary look and see to assess how much evidence is available on a specific topic, like a specific fiber or outcome, and it can also be used to identify gaps in the existing literature. Now to provide a bit more information specifically on SRDR, where the database is housed. SRDR was developed by the Evidence-Based Practice Center at Brown University with support from the Agency for Healthcare Research and Quality, as I mentioned earlier. It's a free, publicly available data repository, meaning that on this site you'll not only find our fiber database, but many other databases housing information on a variety of topics, on everything from other nutrition-related topics like sugar-sweetened beverage intake, to databases housing studies on transplant patients or adults with depression, just to name a few that come to mind that I've seen listed under their published projects. The purpose of the data repository is to create a free and open or publicly available place that users can search to identify potential publications of interest on a given topic. A second purpose is to provide a tool for actually extracting the data to create these databases. In other words, if you wanted to create your own database, you could use features in SRDR to create user-friendly data entry forms. However, I'm not going to go into that today since this talk is on accessing and using an already created database. SRDR does allow for ongoing critique. There's a number of comment fields throughout where users can publicly comment on an entry. It also allows for updating and revision. In the case of our database, we posted version 1 in April of 2015. That version included literature from 1946 to September 2013. We then updated the database by posting version 2 in December 2015, and that added the additional papers from September 2013 to May 2015. Overall, the database provides access to published literature identified in a systematic way. It can be a useful starting point for anyone conducting a systematic review, and it promotes transparency and reliability in the systematic review process. And we're happy to say we currently do have funding to update our database for at least the next 2 years, and that the 2016 update is currently underway. If you navigate to SRDR's homepage in your browser using the link provided on the slide, you'll see the following. Anyone can browse through the site and view a list of published projects. However, users must be logged in if they actually want to download a database. And this is pretty simple. It just requires creating a free account with SRDR. One thing that I wanted to note is that SRDR generally recommends using Firefox over Internet Explorer. We've used both here, and we have generally had an easier time accessing and downloading data with Firefox. Now I'll show you how to access the Fiber database. Once logged in, users can select the Published Projects page to locate the Diet-Related Fibers in Human Health Outcomes Database version 2. Newest posted databases are typically at the top of the list, so you may need to scroll down or select over to a subsequent page to locate the database. You can also use the sort function to sort the published projects by title, scroll down to the D section, and locate the Diet-Related Fibers database that way. Once located, select Show Downloadable Content. In downloadable content, you will find 2 documents available. The database itself, which is in a Microsoft Excel format, and also the user manual, which is in a PDF format. One thing I did want to note is that in order to download any of these documents, you need to first agree to the Creative Commons license, as indicated here in the circle. If you forget to check the box agreeing to the Creative Commons license, you'll receive the following error message and you'll be unable to download the documents, in which case you just have to go back, click OK, and then click the license agreement and try again. Another error message that I wanted to highlight, as we've received it when trying to download the database from SRDR, is this Excel error message telling you that the format or file extension is not valid. I'm not exactly sure why this message comes up, but in my experience, if you receive it, all you have to do is click on OK and then attempt to download the Excel sheet again. I've never encountered this error message more than twice, and I've always been able to successfully download the Excel file by just clicking OK and trying again. You will then receive the following window to download the database, and you will want to download it in Excel as that is the native format. The database Excel file opens up to this general information page, which if you scroll down the sheet, you'll see provides a list of all the included entries, including title, author, and PubMed ID information. And you will also see, as circled, other sheets listed that I will cover later in the presentation, including design and outcome information. As I mentioned, if you scroll down the general information sheet, you'll see this, a list of all the entries included in the database. PubMed ID or PMID, title, year, and author fields are all pretty self-explanatory, but other fields are not. So I'm going to spend a few minutes discussing these other fields to help users decide if and when they may be useful. One thing to keep in mind is that the data from this general information page is automatically created by SRDR, while the actual content of the fiber database, meaning the data that we extracted, is contained in the design and outcome details sheets, which I'll discuss later. So this first column, the study ID field, is an SRDR generated ID number. Another ID field, as I mentioned, is the PubMed ID or PMID, and one important distinction to make is that the SRDR generated study ID is a unique ID per database entry, while the PubMed ID is not necessarily. As covered in much greater detail in the user manual, there were certain cases in which one published paper detailed more than one distinct study. So in these cases, the studies were entered separately into SRDR, and due to the way in which data must be imported into SRDR, the PubMed ID will appear missing for these studies with multiple entries. This is just a limitation of SRDR. So multiple study entries are instead denoted by both the missing PubMed ID as well as, I'll show you here, a number at the end of the title to indicate the number of entries for that paper. So as you can see here, it's two papers with the same title. So they would share the same ID because it's the same paper, or they would share the same PubMed ID because it's the same paper, and thus that PubMed ID will appear missing, and the way to distinguish the two studies in SRDR as two unique entries is by that one or two at the end of the title. No papers contain more than 3 distinct studies. In other words, there were no papers with more than 3 entries in the database. And really the take-home of all this is that depending on your purposes, you may find the study ID useful in certain cases, and you may find the PubMed ID useful in other cases. It kind of depends what your intent is. In terms of the key question variable, going back that you see in this last column, the key question for the database was simply, is this a fiber intervention study? The answer, of course, had to be yes, because if it wasn't, it was not eligible for entry in the database. So yes is coded as 1. So if you scroll down this key question, you'll see every single one has an answer of 1, meaning yes. Again, this is just an SRDR auto-generated field. We don't really anticipate that it's going to be a useful variable for any users because it's just always yes. Also, information on creator, create date, and last updated date is not really relevant to this database as the data was imported retrospectively. And so this makes sense. I'm going to provide a little more information on how this retrospective import happened. So what we did was we first used that data extraction feature in SRDR that I mentioned at the beginning of the talk. In other words, we used SRDR to create data entry forms that were kind of user-friendly. We entered all the data in this manner, and then once the data was entered, we then exported it from SRDR into Excel and then into SAS, and we cleaned it in SAS. The data cleaning pretty much entailed quality control checks, including examining missing data, data that didn't look feasible or within range, or also just verifying data that seemed unclear. Once it was cleaned, the data was re-imported into SRDR to create the public version of the database that you see here. So hence that's why, even though we used SRDR to extract the data, it's really a retrospective data import. So the creator variable doesn't represent the person who originally extracted the data. it represents the project member, who is myself, who just batch imported that data retrospectively after it was cleaned. Similarly, the create and last updated dates reflect the dates that the data were retrospectively imported and published in SRDR, rather than the original dates that the data entry occurred. So again, just to highlight, these fields are auto-generated. We don't really anticipate that users will have a great use for these variables. I just kind of wanted to help people understand what they were and why they're there. Finally, you'll see there's an alternate ID field. We didn't use this as we already had the study ID and the PubMed ID. We didn't really see a need for a third ID variable. And then you'll see also the quality field. This was actually added after our project was completed. So as stated in the user manual, our database was not intended to assess study quality, so it will be blank. And then finally, entry for all the papers is of course completed because it's posted and publicly available. Thus, that status field is also going to appear blank. I think the status field would be useful if you were viewing a database that was in progress. You could see, for example, which papers were completed versus not completed versus partially completed. So now getting back to those other spreadsheet tabs that we saw. This requires a bit of explanation as SRDR automatically generates tabs that don't necessarily apply to every project. In the case of our fiber database, the only data tabs for our project are the design and outcome detail sheets, and you'll see those circled on the slide. The design sheet contains information on study design, study population, the fiber intervention, and also the comparator or placebo intervention. For a comprehensive list of all the variables and valid responses, you can see the user manual. But just, to give you one quick highlight, the database is able to capture up to 4 fiber interventions and up to 4 comparators within a single study. The outcome sheet captures detailed information on up to 8 study outcomes, and for a comprehensive list of all the outcome variables and valid responses, as well as information on how outcome data was prioritized for entry, please see the user manual. Now that I've mentioned the user manual several times already, I just wanted to show it to you here. It's an important component of the project, so I feel like you can't overstate that users should download it, and we recommend carefully reviewing it before embarking upon a project utilizing the database. It contains detailed information on the overall database, on the variables, and also nuances of the data that you might otherwise not know. Everything you've seen up until now in terms of viewing the data involves viewing the data in a downloaded Excel sheet. And I think that downloading into Excel and importing into a statistical software package, such as SAS, is probably the best and most efficient option for analyzing data. However, I did want to make you aware of another feature of SRDR, which is to preview the data directly in the web browser. And this can be achieved by finding the fiber database on the list of published projects, just like we did initially. But instead of selecting Show Downloadable Content, you can select the Preview option. And the Preview option will take you here, which is where you can find a brief project summary. And you can then scroll down to view all of the entries included in the database. If you select on a single entry, you can then see the individual study design information for that entry. So this is just another way of viewing the same information that would be captured by the Design tab in the Excel spreadsheet. While this single entry study design view is not generally useful for data analysis purposes, it could be useful for users who are just looking, kind of scrolling through and want to find a brief snapshot about a single study. Before we wrap up, I wanted to highlight some limitations of the database. First, the electronic search strategy was restricted to the Medline database. Medline houses over 20 million references dating back to 1946, and index journals are reviewed and recommended by an NIH chartered advisory committee, so we felt that Medline provided a means of maintaining some level of quality control while still capturing the majority of human research. However, it obviously doesn't include every paper ever published, so secondary searches might be recommended depending on your project goals and what type of literature you were looking to capture. Second, and I mentioned this earlier, the database does not capture study quality, and it also does not capture the direction of the evidence. So it will identify a paper that examined a specific fiber and a specific outcome, but it will not tell you whether that fiber and outcome were positively or negatively associated. You would then have to go find that paper, access it, and determine that yourself. Third, the database does not link specific fiber exposures to specific outcomes within a study. What the database does do is identify that, X number of fiber exposures were looked at and X outcomes were looked at. It doesn't necessarily tell you whether all the fibers were looked at in relation to all the outcomes or whether it was certain fibers in relation to certain outcomes. Again, you would have to go back to the original paper and determine that yourself. The database captures information only as it was reported in the published manuscript. So in other words, we made no attempt to contact authors. And finally, we largely use single data entry due to the fact that there were simply not enough resources to facilitate double data entry. I'd now like to spend a few minutes talking about how this fiber database can be used in research. To do this, I'm going to present some ways that we have recently used the database centered around evidence mapping. So for those of you who are not familiar with evidence mapping, it's a method of identifying, organizing, and summarizing scientific evidence on a broad topic. It systematically examines the extent and range of research activity on a topic or in a field. It's replicable, potentially non-exhaustive, and it can provide a foundation for other more focused work. So why use an evidence map? Well, it's valuable in areas of fast-paced research where gold standard reviews and meta-analyses can become quickly outdated. It's really useful for characterizing research on fast-growing topics, such as, I know there's been one recently done on sugar-sweetened beverages, or also on topics with multiple exposure types. This was particularly great for our topic of dietary fiber because there's a huge amount of literature on fiber. Combine that with the many different ways that fiber can be given as an intervention, along with the many different outcomes that can be examined. It makes evidence mapping a particularly useful method for looking at dietary fiber. In addition, it's useful for identifying how published reviews fit into the field. It's great for looking at the existing mix of studies on a topic, and it also helps to identify research gaps and questions. Our first project utilizing the database was led by Callie Sawicki. At the time, she was a master's student at Tufts. She's recently graduated and is now working with our group full-time as a research assistant. And she restricted the database to outcomes related to the human gut microbiome, which was a field she was interested in. And she created an evidence map to summarize the dietary fiber literature on this topic. So one aspect of her work that I thought would be particularly interesting to highlight is the bubble plot that you see in the lower right-hand corner of the slide. In this plot, each bubble represents a study, and the size of the bubble represents the relative sample size of the study. Placement of the bubbles is random, but bubble plots like this one are a great way to visualize where the literature stands. So for example, we can see that there are far fewer microbiota studies on dextrin as compared to oligosaccharides. Callie also went on to classify the microbiome outcomes in the database into 4 general groups that emerged: bacterial composition, fermentation, short-chain fatty acid production, and fecal pH. From this plot, we can see that they are all fairly well represented in the literature. However, let's say that, for example, this was not the case, and we saw that all the bubbles were concentrated within 1 or 2 of the outcomes. We would then be able to think about why this might be, why there's this gap in the literature, whether those areas that had gaps would be useful for pursuing in future research. So again, it's just a great way to visualize what's out there and, also to see what, if anything, is missing. Callie presented her work at the 2015 Experimental Biology Conference, and we invite you to watch the brief YouTube video at the link on the slide if you are interested in hearing more about her work. In addition to Callie's work, we have had several other students create evidence maps using the dietary fiber database. Danielle Haslam, a master's student at Tufts, restricted the database to examine all studies focused on legume fiber interventions. As you can see from the pie charts above, her work highlighted the types of legume fiber captured in the literature, as well as the diversity in the types of outcomes that were examined. Also, Vrishab Shah, who was a student at Boston University, conducted a similar analysis examining the literature on resistant starch fiber, and this work was further expanded upon and will be presented at the 2016 Experimental Biology Conference in San Diego. I also created an evidence map examining dietary fiber as a whole, in other words, all of the literature captured by the database. This work will also be presented at the 2016 Experimental Biology Conference, and it really provides a general overview of the database and its contents. So just to give you a few quick highlights, Dietary Fiber Database version 2, it contains 919 entries, which detail over 1,400 fiber exposures and over 3,500 health outcomes. The majority of studies were randomized control trial crossovers, but there was also a fair number of randomized control trial parallel studies. Guar gum was the most frequently reported fiber, and total and LDL cholesterol were the most frequently reported outcomes. As I mentioned, of course, while the database is downloadable in the form of an Excel spreadsheet, we would recommend importing the data into a statistical software package for more efficient analysis. We use SAS here, but Stata, R, and SPSS are just a few other programs that you may find useful. It may be best to consult with your statistician before analysis. You may also get in contact with our group here at Tufts for help and/or guidance on using the database. I hope you have found this overview to be useful, and please feel free to contact our group through Principal Investigator Dr. Nicola McEwen with any further questions. For example, we've already had some users email us asking why a certain paper that they knew about was not included in the database. This is something that we can look back at and track and let you know why it may or may not have met inclusion or exclusion criteria, why it was not included. Also, even if you don't have questions or need help, we'd love for anyone using the database to just let us know. It will help us to demonstrate the value of the database, and that will hopefully help us to keep securing funding to keep it updated on an annual basis going forward. SRDR provides guidance on citing both SRDR itself and specific database projects within SRDR. So you can check out the link on the slide for more specifics on how to do that. And also, we would ask that data users acknowledge ILSI as a funding source through the following statement listed on the slide. I just wanted to end with a couple quick acknowledgements. First, thank you to ILSI North America Technical Committee on Carbohydrates for providing the support for this project. Also to our co-investigator, Mei Chung, who is in the Department of Health and Community Medicine at Tufts. Our current project team members, Callie Sawicki and Daniel Haslam, and also our previous team members, Dina Wang, Caitlin Blakely, Nikki Baruch, Michaela Carlson, Carrie Brown, Yinan Jia, Mengzi Du, and Vastab Shah. All of these people helped with data extraction and cleaning. And finally, to Brian Smith and the team at SRDR for all their help in troubleshooting. Thank you for listening and for your interest in our work.